In this video, I'm going to show you how you could fix hip flexor tendonitis. Guys, what's going on? My name is Dr. Nick Bonforte, physical therapist. So hip flexor tendonitis is a super common issue, and when we're dealing with a tendonitis or a tendinopathy, so in this video, I'm going to be using those words interchangeably. One just relates to the duration of what you're dealing with, and one is short term. So tendonitis is initial stages of a hip flexor issue coming up, and when you're dealing with it for a longer period of time, that's when we tend to relate to it as a tendinopathy. So I'll be using them throughout this interchangeably. So when we're dealing with a hip flexor tendonitis or tendinopathy issue, we have to think about why this is potentially happening. Commonly, when we're dealing with a tendonitis issue, it's because of overload to that particular region of the body. So when we're overloading the body from a muscular standpoint, the muscles attached to the tendons and the tendons attached to the bones, when we're putting too much stress and force to this region, it can't withstand it. There's a little bit of fraying and straining of the fibers, and then it develops into some pain because of some low level inflammation and things like that, and that starts to develop into the tendonitis. So it's really from a loading perspective. When too much stress is to a particular region, it can't withstand it. Tearing, micro tears happen, develops in pain. So now there's two common hip flexors that tend to get sparked up in this tendonitis issue. One that crosses the hip and the knee, which is the rectus femoris muscle. That is a big hip flexor muscle, and it's one of the quad muscles actually. And then the other common one that we always hear about is the psoas muscle, which is really a combination of two muscles, which is the iliopsoas muscle. So one muscle originates on the pelvis and the other one originates really on the spine. And then they come down and they attach to one tendon onto the hip bone. So we also have to keep in mind tendonitis or tendinopathy issues can spark up from other reasons other than a loading perspective. That's just the most common thing that tends to spark up these things. But for an example, if you lack flexibility or mobility at the hip and it causes some joint mechanic irritation, that like a rubbing effect of the tendons of the hip flexors, that could be a potential cause of this tendonitis issue as well. In this video, we're going to keep in mind from a loading perspective of dealing with this issue and things we could do to solve this. Let's dive into some of the exercises to start addressing this. All right, so with this one, we're working on end range hip flexion isometrics. Now, like I said, tendinopathies are sparked up from a loading perspective. So we actually have to build some load to that particular region, but we just have to modify the intensity. So with this one, we're working on a low level isometric with this banded march. And the idea here is to hold it for a longer period of time to build more adaptation to the muscular tissue. So when we have a straining effect to the muscular tissue or the tendon, we have to put some input into that in an isometric way, which ultimately will help reduce pain and build the loading capacity of that region. By doing this isometric, we're not putting too much load through it in a dynamic way, and that way we can lower the symptoms in the short term and then help build up the capacity in the long term. This next one is working on the eccentric component to the hip flexor muscles. Now, when we are improving the force capacity of the muscle tissue, we progress in stages. So we originally start from an isometric standpoint. Once symptoms go down and we're building the strength, we move on to a lengthening fashion, which puts more loading to this region. So this exercise, we're working on that particular case of the eccentric training. So we're really biasing those hip flexor muscles that are typically caused in this issue. Now with this one, I'm rocking my body backwards and I'm controlling it with my quad muscles, but at the same time, I'm thinking of squeezing my glutes really, really hard as I go down into the motion. What that does is it posteriorly tilts the pelvis, which in turn lengthens the hip flexor muscles, the iliopsoas, because that anteriorly tilts the pelvis. So we're really biasing those two muscles at hand, the rectus femoris muscle and the iliopsoas muscle, with this one simple and effective go-to exercise to put some lengthening load to the hip flexor region. So with those two exercises, we looked locally at the hip flexors itself. Now we have to take a little bit more of a global aspect, and we have to think too from a loading perspective. If the hip muscles aren't as strong, more load will go to the hip flexors in this particular case and then overwork them. So we have to work on the hip muscle strength to help alleviate some of the hip flexors from doing all the work. So this exercise, this is a great stabilization and strength exercise for the hip muscles. This one, it's a lot harder than it may look, and we're really working on the stabilization of the hip and how it can control the hip throughout this. So with this one, I'm controlling the hip going in nice and slowly, and I'm coming out of that position throughout this exercise, ultimately working on the strength and stabilization at the hip. So there you go. Hopefully you gained some insight and value and understand a little bit better why hip flexor tendonitis or tendinopathies come about, and things you can start to do to lower the pain or lower the discomfort that you potentially might be feeling to this hip flexor region. Hey, before you go, if you found value in this video, I would really appreciate it if you support my channel by subscribing down below, liking this video, and don't forget to turn on your post notifications so you never miss a video from me. This is Dr. Nick. I'll see you next time.